Today I'm going to talk about 6 different things that you can do for Achilles tendonitis or Achilles tendinopathy. First thing that you can and should do when you have pain in your Achilles tendon is to ice it. Tendonitis means inflammation of the tendon. If your Achilles tendon is inflamed, it will be painful to walk, painful to move the ankle, and painful to stretch. One of the most effective ways to decrease inflammation is to ice. You can use an ice pack or use an ice cube to do ice massage for the tendon. When you use the ice pack, make sure to cover the entire Achilles tendon. To do ice massage, the simplest way is to use an ice cube. Just take an ice cube and rub the ice cube along the inflamed portions of the tendon. I like to start with the medial side of the Achilles tendon or the inside of the ankle. Run the ice cube between your calf and your heel. The second thing you can do for Achilles tendon pain is to massage it. Bob and Brad recommended cross-friction fiber massage of the Achilles tendon, specifically the medial side of the tendon or the inside of your ankle. It is also not a bad idea to massage from the calf downward toward the heel along the medial side of the tendon. This provides a small stretch for the Achilles tendon as you massage it. Another option that you have to do a cross-friction fiber massage is to use a massage gun. You want to position the massage gun not directly toward the area you're massaging, but sideways like this. The third thing you can do for your Achilles tendon is to stretch it. Stretching the gastroc muscle of your calf should be first. It is also a good idea to stretch the soleus muscle, but it is more intense since the soleus is closer to the Achilles tendon than the gastrocnemius muscle. It is also a good idea to do ankle range of motion exercises. You can do active dorsiflexion to actively stretch the Achilles tendon. I like to avoid active plantar flexion, especially when the tendon is inflamed. So active dorsiflexion is fine. You can also do active ankle pronation and supination to loosen up the ankle. The fifth thing you can do for your Achilles tendonitis is strengthening. This is a bit advanced and should not be done when your Achilles tendon is painful at rest. It is important to restore strength to the Achilles tendon. Bob and Brad, Ask Dr. Joe, and E3 Rehab all recommend starting with the straight leg heel raises to strengthen your gastrocnemius muscle. Bob and Brad, as well as Tone and Titan, especially recommended eccentric strengthening of the gastrocnemius. This is an interesting strengthening exercise that stretches your Achilles tendon at the same time. To do this, you would do a regular heel raise with both feet on a step. You don't really have to raise the heels very much. The important thing is to have the heels above the level of your toes. And then go into a single leg position with your affected leg supporting your whole weight, and gently lower your body's weight until the heel is below the toes. Then use both feet to raise the heels back above the level of the toes, and you start over this process. Lastly, for strengthening, E3 Rehab also recommended strengthening the soleus muscle with the bent knee heel raises. The last thing I want to mention that you can do for Achilles tendonitis is kinesiotaping for Achilles tendon. Kinesiotaping is a pain relief modality that you can consider when you have pain when walking.